So the title of my talk is The Role of Exercise in Supporting Kidney Health. So what I'd like to talk about this evening is I'd like to talk about the role of exercise and physical activity in promoting and supporting health in people with kidney disease. I'd like to talk a little bit about the research behind that, scientific research, and also the patient experience. And I also want to talk a little bit about how we can make moving more easier and part of our kidney care culture. So I think it's really important just to always acknowledge that the effects of kidney disease can affect your physical functioning. And this isn't always clearly explained, that there actually is a pathophysiological reason why you don't function physically as well. So I'm going to highlight this with a common example. So when the kidneys stop working very well, you might know that they stop clearing acid from the blood. And sometimes your doctor will put you on sodium bicarbonate, and that's why we put sodium bicarbonate in the dialysate if you're on dialysis. So this is what happens when the kidneys start to fail. Acids start building up in the blood. And we know that that can actually lead to fatigue. So the effects of the acid on the muscle can actually cause it to not reform muscle as strong. So one of the effects of that is people feeling tired. And we happen to know that fatigue is a very common complaint among people with kidney disease. So what happens if you feel tired is naturally you're not going to want to engage in physical activity. And then when you don't do physical activity, the body does miss out on that opportunity to grow back stronger. So you may have heard, if you don't use it, you lose it. And this is sort of a fancy way of explaining this. So if you don't break your muscle down and let it build back up stronger, then it won't get stronger. And if you don't let your heart pump and your body work and your blood pressure lower when you exercise, you don't get that benefit. What happens next is we see this as a decrease in endurance and muscle mass and strength, and also in balance and coordination. And so what does that lead to? Well, you see that in your everyday life. It gets harder to get upstairs. It gets harder to play with the grandkids for longer, and people tend to feel more played out. And then overlaid on top of that are the effects of kidney disease. So when I say uremia, I mean the kidney toxins. Inflammation is higher with kidney problems, and then nutrition's harder. And nutrition's harder for a lot of reasons. It's a lot of reasons to do with the things that we say that you can't eat, and also just having a loss of appetite and food enjoyment. And so then you can see with physical functioning, if doing everyday things becomes more of a struggle, you're going to become more sedentary and less active because it doesn't feel good. It's not as enjoyable. And you can see from that cycle that it just sort of propagates. And I show this slide for two reasons. Number one, I think it's really important to know that there's a physiological reason why exercise is harder for people with kidney disease. And I think the people who I've talked to do try to beat themselves up and say, I know I should be. But listen, give yourself a break. There is an actual physiologic reason, and this is just one why it can be more difficult. But I also think that this slide is nice in the fact that it shows you that we can break the cycle by working on that middle rectangle, the physical activity. That if we start promoting that we can interrupt this vicious cycle of deconditioning and having less life participation. So does it actually help? What do the studies tell us? So we do know, and we can tell you that no matter what your stage of kidney disease, that regular exercise, something like 3 times a week, and how long depends on, where you are starting. But we do know there's benefit from even just doing 10 minutes at one time to start with. That if you do that, you can improve quality of life for the physical aspects. So how you feel functioning in your everyday life. We know that we can actually improve objectively measured things like fitness. So it is easier to walk upstairs and get around the grocery store. And we do know that we can increase your strength, your ability to get in and out of the chair and get in and out of the car and around easily. We know that we can make people walk further than they did before they started exercising.